Hello, everybody, and welcome to our next soul searching conversation with Sanam. I'm Sanam Lalwani, and I'm so lucky to host another session with you all today. I feel honored to be here today with you, Dr. Gaurang, and so thank you so much for this. In fact, I recently learned from my parents that my grandfather believed in homeopathy during the 1960s and 1970s, and he used to practice it for his family and close friends. So I'm so excited about this. It's awesome to hear that I have this connection with homeopathy going way back, and I didn't even know about it. Also, I still remember when I was first introduced to you, I felt a very strong vibe of positivity from you. So, without any further delay, let me introduce our esteemed guest, Dr. Gaurang Gaikwad. Welcome.
Thank you. Thank you. It's an absolute honor to join your talk, and I'm looking forward to it, to sharing some nice conversation with you about homeopathy and about life in general.
Thank you. Thank you so much. Dr. Gaurang is an accomplished homeopathic practitioner and an internationally acclaimed teacher. He is one of the most dynamic teachers among the younger generation and has been training homeopaths across the world in these past few years. His approach is a blend of classical homeopathy and advanced kingdom methods. He comes from a rich heritage of doctors in the family, where both parents are ophthalmologists. He has had many mentors who have inspired him, and he was initiated into classical homeopathy by Dr. Vaishnav. Dr. Gaurang was fortunate to work as an apprentice for many more well-renowned doctors in this field. He worked closely with Dr. Sankaran on a few internationally acclaimed books about synergy in homeopathy. Dr. Gaurang has recently published few books of his own too. He has his private clinic in Matunga, Mumbai. Many homeopaths from Europe come to his clinic to get training in clinical homeopathy. This passion of his has led him to conduct webinars and online lectures, as well as his YouTube channel, The Homeopathic Hub, imparting and sharing knowledge and experiences. He is actively involved in the research work of hormonal and autoimmune disorders. Recently, he was awarded the late Dr. Mahindra Singh Memorial National Award for Best Teacher in Homeopathic Field 2020. So congratulations. Wow. This is an outstanding achievement, Doctor. So my first question to you is, what brought you on this path of homeopathy? And what are the basic principles of homeopathy? And how does it work? I thought maybe you could give us a brief understanding of this.
All right. So I'm going to just explain you, because a lot of our participants today are probably people across the globe who are trying to understand what we are trying to talk. So I'm going to give you a little brief idea about what we do and what is homeopathy. So I'm going to use the power presentation here. I'm going to share the screen.
Okay.
So if my team can let me share the screen, please. Okay, now I think I can. Okay. All right. So what is homeopathy and what is the potential of homeopathy? Homeopathy was born hundreds of years ago, um, in Germany by our founder. This is our founder, Dr. Samuel Hahnemann. So, contrary to what many people feel, because homeopathy is so popular in India, people feel that homeopathy is actually originated from India, but that's untrue. Homeopathy is actually originated from Germany. By this is our master, Samuel Hahnemann. He actually was an allopathic doctor, but during his time, he was very kind of disappointed with the situation with allopathic medicine, and that's where he kind of discovered homeopathy. Homeopathy is based on very basic principles. What are the principles? We call it as the law of similars or holism, individualization, which means that homeopathy tries to treat the person in the disease and not the disease itself. So what homeopathy basically does it basically works at an immune system level so that the body's immune system itself can accentuate and cause healing. And that's why in different diseases, right from cold, cough, fever to autoimmune diseases to hormonal disease to cancers, different diseases, homeopathy has a brilliant scope. Um, just to tell you in short, in allopathy, there is a diagnosis, which means if you have a headache, if Sanam has a headache, there is a medicine for headache, like a painkiller. In homeopathy, to tell you in a little bit more layman term, it is a little bit like a fashion designer. How a fashion designer will customize a kind of a clothing for you depending on your fit, your style, your feel. Homeopathy is a little bit like that, where we try to understand the person in the disease. We try to ask many questions. Homeopaths are generally very famous to ask many questions and some very intricate details. This is just to understand patterns. And understanding these patterns inside a person, understanding this person, we basically prescribe a homeopathic remedy which can work at immune system. To give you an example, this is a very interesting saying. My headache is different to yours, which means, one person may say, I have a headache. So you may ask, okay, you have a headache. Okay, take a painkiller. In homeopathy, it's not like that. We have to understand the exact detail. Some patient may get a headache, which is more like a throbbing pain on the right side. Some person may get like a stitching pain, which is more in the back of the neck. Some person may get like a dry sensation in the eye that is going inside. So all these intricate details are very important for a homeopath to understand. And that's why we call it that homeopathic medicine can remove the disease from the root. The idea is not at a superficial level, but at a deeper level. Just to give you a little idea, I'm going to just very briefly in next 3 minutes show you some very interesting results that I have homeopathy has had.
Great.
So this is one of the first case that I saw. This is a 6-month child who had an eczema all over the body, okay, and especially on the face. This patient, his grandmother was based in Bangalore, and from there she contacted me, and we started with homeopathic medicine. In 4 days, you can see the change in the skin. If you can see that on the skin, in 4 days.
So much different.
Yeah. That's why we also often say homeopathy is very brilliant for children, infants, because it acts at the immune system level. And, patient getting allergic, cold, cough, nowadays viral fevers, tonsillitis, adenoids, allergies, skin allergies. Homeopathy is brilliant. This is another child, and she had this is called like a alopecia areata, which means like a spot, hair fall. Yeah. With homeopathic medicine, within 6 months, the hair fall improved. Many cases. I'm going to quickly tell you. This is a case of herpes zoster, not getting better by homeopathic medicine. Within 15 days, it got better. This is a case of infective psoriasis. You can see the hands. Worst case of psoriasis in India, treated only with homeopathy, and you can see the result. Okay,
and that's the result.
Case after case. This not just skin cases and allergic cases, but now I am associated with many different hospitals in India. And as you already know, even during COVID times, we gave homeopathic medicines across India, across Europe, helping many patients. This is one of the case of a child who was in coma stage, not improving anything. We started with homeopathic medicine and he came out of coma with help of homeopathic medicine as well. Now, the very important thing here is that the patients can take allopathy along with homeopathy so that there is no problem, because the main thing is homeopathy has no side effect. This is another case of very bad skin psoriasis, we call it. again treated just very beautifully with homeopathy. So case after case after case. This is one of the case of a very bad eye infection, just treated with homeopathy. So we can go on for the next, I don't know, roughly about 2 hours, and I can keep showing you case after case. This is just to basically give you an idea that homeopathy works at a deeper level. It removes the disease from the root. And the idea is that we ask many, many different intricate questions, ask about your fears, your dreams, your stress, your basic nature, and then we prescribe a homeopathic medicine which can go at a deeper level and really help work on the immune system and cause healing. So this is a little bit of an idea I wanted to just give you before we start our talk.
Beautiful. Wow, that is, you have an extraordinary aptitude for homeopathy. This is really, really beautiful. And I just feel that with your determination, you look like you want to keep learning and discovering new ways, to treat these patients. But really, because my next question actually was about, when you ask about the sensations, how does, like, I just want to know a little bit more, like, what was the feeling you had when you had this pain or that issue? Like, what, can you just give another example, like, of a situation where
I will give you a real example. So
Okay.
basically, I will give you one example that I recently did. So day before yesterday, I did a case. It was a case of joint problems. This arthritis, very common in women, men, joint pain, knee pain, hip pain, ankle pain, and now I'm seeing patients all across the world on Skype, on video conference. In India, now I'm seeing patients in Dubai, I'm seeing patients in Europe, America, different parts. So we do it on a video conference because of the situation. So this patient had a big kind of a joint pain. So I asked her, how did your joint pain start? This is very interesting, Sanam, for you to understand. She said that, there was a big disappointment. What happened was that, I was very close to a person, and this person, just separated from me. So I asked, what is the feeling there? This is common, right? If you are very close to someone and someone separates, you feel bad.
Yeah.
In homeopathy and in real psychology, because homeopathy is connected to psychology as well, we try to go a little deeper. So I asked, what is a deeper feeling? What was the inner feeling? So she said, I felt bad, but at a deeper level, I feel cheated. I said, okay, describe this cheated a little bit more. She said, I feel totally betrayed. I feel like totally deceived and betrayed and cheated. I asked, okay, tell more. And she said, I felt the same feeling in my childhood when my mother would beat me and the teachers would insult me. I used to feel very cheated. So this feeling of being cheated ran through. This was her inner pattern that ran through her entire life, and that's what probably caused her disease actually in the first place, because too much of suppressed emotion keeping inside very often terminates into symptoms and later on into diseases. So this is what we do, and I'm trying to understand this pattern and then finding a remedy that can work on that pattern. That's what we do.
Yeah, that's what, I was wondering, because I did watch one of your, you were talking about a case study of somebody with a knee pain and how you went deeper and you were telling them step by step what you should do. So this is really helpful to understand, because I guess as a patient, I keep feeling, but why does he need to ask me that? Like, what is the connection? But now,
there are two reasons. Very interesting question, Sanam. There are two reasons for it. The number one reason is that to find a remedy, that is, in homeopathy, every different feeling has a different remedy. Okay, number one. And number two is, sometimes when I ask some patients, what do you feel? And they said, I never thought about it. I never thought this is important, And I ask, okay, describe this. Oh, I feel cheated. I really feel cheated. That's right. That's my inner feeling, And sometimes letting the patient know that, this is actually your inner feeling can actually cause a lot of healing within.
Yeah.
So I also do a lot of, consultations where sometimes I don't give the medicine also. I just basically counsel the patient, and, it's more like a therapy where I explain how the patient can now come out of the block that they have got into.
Yeah.
So this is a very beautiful kind of a process.
Yeah.
That we do with our patients.
So it's very holistic, not just
very
Yeah.
holistic. And this type of therapies, this type of treatments are required in today's time, and not the treatment with tons of medicines that
Yeah.
many patients are taking for years and years. We require to go more towards holistic and really these form of medication.
Yeah, no, that's really amazing to hear that. So you did mention something about dreams also. So how does talking about your dreams help you in your diagnosis? Like, where is that connection come
Very good question again. And this is one of the commonest questions, because very often my patients later on, they joke with their other friends. This doctor I go to, he always asks me about my dreams.
from?
And I make a diary and I have to write those dreams, and tell him after a month during the follow-up. And it's very interesting. So I'll just tell you that there's a lot of science behind this. Homeopathy is not just a quackery. There is a lot of art and science behind it. Dreams, by the way, Sanam, is a kind of a window. Sigmund Freud, one of the fathers of
Yeah.
human psychology, he understood a lot of psychology based on dreams, because he said dreams is basically a window of your subconscious state. There are many things that we feel, but we don't express.
Yeah.
They suppress inside, and sometimes they are kind of expressed in form of dreams.
Yes.
And when these dreams are repeated, there is a pattern to this dream.
Okay.
They can be very important to understand suppressed emotions, suppressed feelings, which help us to uncover and help. For example, one of my patients tells me, doctor, I get this dream again and again, that, and it's like a nightmare, that, I'm sleeping and there is a kind of like a ghost sitting on me, and I'm trying to scream and the voice is not coming out. I'm screaming, ah, and there is no voice coming out. And I get so scared and I get up and I tell my husband that, this happened. I go into a panic and the whole house is in a panic. So this is a very important pattern that, she's trying to do something and she's unable to do it. This is an inner pattern that based on this, we can prescribe a homeopathic medicine. So there's a lot of science and connection between all of this.
Yeah. Yeah, that's very fascinating, because I actually studied psychology and Sigmund Freud, but I never thought that there would be a connection with homeopathy until today.
Sanam, generally, I found out in life, in the end, everything is connected.
Yeah.
Not just Sigmund Freud and homeopathy and psychology, but all of us are actually connected. And every situation, this whole world and the entire universe is actually connected. It's called as like a butterfly effect. Everything is connected.
Yeah, I totally believe in the same thing as you. That's amazing. So then, mostly, what type of problems do people come to you for? Where do you see a pattern there, or is it just across the board?
In my clinic, I see all kinds of cases.
Okay.
Women's health problem, polycystic ovarian disease, infertility, sexual problems, autoimmune problem, cancers. Now I'm seeing many COVID cases, post-COVID cases, which means that, someone had a COVID and after COVID, they develop a lot of anxiety, or they develop neurological problems, or cough problems, or headache problems. So many different ranges of cases. We often say that, where the allopathy finishes, homeopathy starts, which means the kind of area there, the allopathy says that, there is not much medicine in this. That is where homeopathy can begin. So there is a lot of scope, especially in chronic cases for it.
Yeah. Wow. So that's great to hear. You've helped a lot of COVID cases, because it's been really happening.
I would say that we have, not just me, and I'm not talking only about myself. Many homeopaths, hundreds of homeopaths across India, Europe, America, Brazil, have helped, I would say, countless patients suffering from COVID and suspected COVID with help of homeopathy.
And that also has a psychological effect, like you said, right?
Absolutely.
And there's a whole, spectrum of fear around the whole thing.
There's a whole panic, no?
Yeah.
Entire panic. And this is where homeopathy can cause like a mass healing. If the secret of homeopathy is actually finding a good homeopath. I always, my students or my patients who are sometimes ask me, will this get cured? I often tell them, you find a good homeopath and don't change the homeopath. Wait with that homeopath for 6 months to 1 year. And even cases which are not improving, they can improve gradually.
Okay. Yeah, because actually a friend of mine was asking me to ask you, for hemorrhoids or
Beautiful.
Yeah,
I have many cases of hemorrhoids.
you
which-
have,
which have
okay. But she
fistula.
said like after 3 months, there's still no improvement. So like,
So give the homeopath some time. And I want to tell you, homeopathy is not like a magic. Okay.
yeah,
Along with homeopathy, you have to do lifestyle changes. You have to make all the other changes in your life, your diet, your exercise, your lifestyle. And when you add that with homeopathy, then it will work.
okay, all right. Okay, that's good to
I
know.
want to tell you that, basically, as patients, as humans, we have to start taking responsibility of our own health. We can't let the doctor say, okay, I have this problem, give the medicine, I will keep taking it. It doesn't work. We have to make
Yeah.
changes in our life.
Okay.
So the homeopath, the doctor will guide you towards it. But finally, we have to take responsibility. That's what I try to do for my patients, actually.
No, that's good. That's really good to know. How long do homeopathic medicines stay in your system for example?
So very often, one dose that we give can remain for 1-2 years also,
Oh, wow. 1 year.
for 10 years also. So
Okay.
it depends on the case, it depends on the remedy that we have given, and it depends on the power of the medicine that we have given also. There
Yeah.
are cases where I've given one dose, it has worked for 10-15 years. So it depends. It's a very kind of an individualistic kind of situation.
Yeah, true. So then what happens if somebody misses their homeopathic medicine at a given time, if they miss that day or?
Nothing, no problem.
No
The homeopath will adjust it in the next dosage.
Okay. Yeah, because sometimes you're told to switch after 1 week to another medicine and then you sometimes forget that one. So, from experience here.
Homeopathy in different cases require different form of treatment.
Yeah.
Homeopathy also is actually practiced in different techniques. There are more than 20-25 different ways of practicing homeopathy.
Okay.
So and which I was lucky enough, and God was great, God is kind, that I got a chance to work with different masters across the country. I spent a lot of years learning with different people, and I was able to learn that art. And now I can kind of know that in which case what to do. So that's the kind of experience that can help our patient.
Yeah. Okay. I love that whole thing. But I just want to know also, are there any foods that should be avoided while on homeopathic medicine?
At a practical level, no food as such can obstruct the healing.
Okay.
But generally, I ask my patients to go to have healthier diet.
Yeah.
And I also ask patients that, if you feel there is something that you are kind of, that you are not comfortable with, or you feel that can cause problems to you or has caused problem to you in past,
Yeah.
then avoid it simply.
So be alert with what you have.
Very important. There is
Yeah.
a famous saying by Hippocrates that let food die be your medicine and let the medicine die be your food, which means food is almost like medicine. It is therapeutic. So be
Yeah.
very, very careful about what you eat and how much you eat and when you eat.
Yeah. Okay, that's so good to know, because now everywhere around the world, people are so conscious about what food has to be.
Unfortunately, there is unfortunate thing. I travel across the world. I teach across the world. It's actually, I say it with a very broken heart, that unfortunately we Indians, we are not very careful and not very scientifically driven towards health and about diet. We we are not very careful. If you travel across and if you see, everyone is very, very careful about their diet, what they eat. They take very good care of their health. For us, the health comes last in the priority. But for many other people in Europe, in America, health comes top priority. So that's why the idea to do many, many webinars, and when I travel and I teach to not only the patients, students, I try to give the idea that we have to create awareness about health.
Yes, I mean, I think a lot of the youngsters now have gotten into it a lot.
The current generation is changing.
Yeah. But so as you are actively involved in the research work of hormonal imbalances, in your opinion, how well does homeopathy work for? You did say about balancing hormones and menopause. Can you explain a little bit more about this?
See, basically, I will just tell you that the hormones, female, male, different, have many problems. Like, for example, females, ladies after the age of 45 develop menopausal symptom.
Yeah.
You develop heat flushes, the period stop, develop hair fall, mood
Yeah.
changes. In men, very often sexual problems. There is a problem to have sex, psychological problems. Men not very often talk about their own problems.
Yeah.
So homeopathy has a very good scope in it.
Mm.
It can really kind of work at a deeper level, and it not only cures, but it basically relaxes your entire system so that it works in a
Okay.
better way.
Okay. That's great. That's great. So, as you're teaching many online courses and you have authored some books and you are a practitioner, how do you manage to balance all these three aspects of your life?
I was just doing a webinar before this so I was invited to a college in Maharashtra called in Kolhapur, which is a place in Maharashtra. So they invited me to teach students of that college on a webinar platform, which I did. So one student asked me that, asked me the same question, that what is your main motivation? He asked that, what is your main motivation? How do you do so many things? So I just told him, and that's what I really believe, that if you require motivation to do things, you require daily motivation to do things, then it will not work for you. It has to come from within. The motivation and everything, you can listen to a Sandeep Maheshwari talk and you'll feel good, you'll be gung-ho. But will you be able to watch it every day, and will it cause the same kind of thing? No. So all these kind of motivations and inspirations are in and around you. They can just stimulate you. But deep inside, you have to be true to yourself. And at a deeper level, I'm a kind of person who's a very passionate person. Whatever I do, whatever I want to do it with a lot of love and with a lot of passion. I want to be like totally involved and give my total 110% till the last drop of my blood. That's what I like to do. And I'm not saying that I'm always successful. There are possibilities. Very often I may not be successful as well, and there are possibilities that I may be successful as well. But I don't let it affect me too much. I just continue the process and I do my very best. And I am very aware of fragilities of results, because honestly, Sanam, as you already know, in a professional field, results are never in your hand.
Yeah.
There are many factors for a result,
Yeah.
So just like the Olympics is going on,
Yeah.
the athlete who works for just 5 seconds of weightlifting, he or she cannot kind of imagine, oh, what if this happened, what if that happens. He cannot work or for the result. He has to keep working in the process, so that he will keep working and working. That's the whole process he wants to put himself into, and not worry so much about the results. That's what I believe.
Yeah, that's incredible. And that's the way it should be, I think. And that's how you can get results.
And the other thing that I often tell all my students, because I'm doing a 6 months course for my students across India and the world, where they learn from me. Because see, now colleges, everything is closed. Where will the students come from? So I took it upon me to do a kind of a 6 month certificate course for all the students across the world. They can join me on the weekends and learn from me. So they often ask me questions like, how are you always very passionate, you're excited? So I just tell them, and I want to tell all the patients who are also watching and listening here, is that you have to understand everything that you see on social media, on WhatsApps, on Instagram, on webinars. It's not totally true. I personally have had different bouts of sadness, depression, jealousy, hatred, loneliness, anger, disappointment, excitement. It's human to feel all of this. We just have to kind of experience that emotion within us and let that emotion pass through. No problem. Experience it and let it pass through, but don't get succumbed to it. And accept that these are all patterns within you. I have accepted, okay, this is me. We are all humans. We have to accept who we are. That's what I do.
Very true. Very true. Very inspirational. Just beautiful. So what would you say, are there any like qualities you felt that you were able to pick up from your teachers, which you feel like you want to be able to let your students feel that? Or
Not only students, for everyone. I want to tell you that I spend a lot of my time with my teachers, probably more time I spend with my teachers than my parents, more or less, in my initial days of my life. But I realized one thing about all of them is that they are students for life, and that's what I try to be. The minute you feel that, oh, you are a teacher, you are achieved this much, you are this, you are that, ego,
finish?
that's the end. So the idea is you have to be student for life, and you have to learn from everything and everywhere. Every situation that has happened to you
Yeah,
or will happen to you is going to teach you something. You have to take everything as a learning experience. That's what I do. So I'm talking to you today. I'm trying to understand things, how it works. This is also a learning experience for me, a kind of a webinar that we are doing with our friends and participants from
yeah,
UAE or your colleagues or your friends. It's a learning experience. I'm trying to learn how it's
yeah,
going,
yeah,
things like that. Everything is
yeah.
a learning experience. And if you actually take everything as a learning experience, it is so beautiful and so
Hmm.
fascinating life is.
Yeah. It really is. I know Buddha has said that when you are ready to learn, your teacher appears. So
Yes.
I guess,
The right terminology for that is, because I'm also kind like to read about Buddha. When the student is ready, the teacher arrives.
all
That is
right.
the saying.
Yes, yes, true, true. And so I think you have been doing that quite well for all the
Yeah,
students, like you said.
I have been a student. I've tried to be a student all my life. Yeah.
But do you feel there's a lot of interest and curiosity from a lot of people to
Uh,
learn homeopathy? Like you see a big surge of,
not just about homeopathy. If you actually see in and around you, if you see any social media channels, if you see any person that you meet, the whole world is now, with this COVID situation and whatever happened last few years, everyone wants to focus at holistic health. Everyone
yeah,
wants to go towards a disease free kind of a situation.
yeah,
Everyone wants to take care of their own physical and mental states.
yeah,
Everyone wants to go towards a healthier kind of form. And that is where homeopathy is one of the things which has a very good role.
yeah. Okay.
So I think there is a lot of interest in people to go towards healthier kind of things. See, I told you I come from a background of allopathic doctors. My both
Mm.
my parents are eye surgeons.
Yeah, exactly.
So I have known this for years. I've sat with them in their surgeries. I've sat with them in your OPDs. When I was a kid, when I was 12 years, I used to check the eye to give an eye number. I knew how to. I was like an optometrist for them. Like how an assistant is. I
Yeah,
used to do like that when I was a kid. They used to take me to a village and make me check, villagers' eye, and I used to check it, and then I used to give a number and give specs to them. So I've seen that all my life. So I understand that there is a scope and area where allopathy is important, and there is a scope where homeopathy is important. We have to understand that all can coexist. This is a very
yeah,
important thing that I learned in last few months, Sanam, and that is that we all can coexist.
yeah.
There's a lot
It's
of
true.
jealousy, competitiveness in and around us,
Yeah,
but the fact is that you can do well, and I can clap for you, and I can do well, and you can clap for me, and we all can coexist. Isn't that
yeah.
such a
We
liberating
are
kind of an
one.
experience?
Yeah, we're one
Yeah.
universe. Yeah.
Absolutely. It made me feel very, very easy, and there was an ease into the way I looked into things when I know that we all can coexist.
Yeah, yeah, I
It's
believe the same thing. That's the reason why I felt doing these type of interviews,
absolutely
brings people
what
together.
you're doing is so amazing for so many people. You're
Thank,
kind of enlightening them with different people's talk. It's one of the
thank you,
best things that you could do. I'm so
thank
glad
you,
you're.
thank you so much. I just wanted to know, if you had a background of allopathy with your parents, what made you choose homeopathy? Like, how did you
Yeah,
go to
very
that?
often people ask me that. I really honestly don't know. But now that I look back, both my parents, even if they were fairly successful eye surgeons, they always had a very open mind, and they themselves always tried homeopathy and
Yeah.
Ayurveda
Okay.
and all this kind of thing, and they kind of knew the area that allopathy can work till this level, and after that you require holistic
Yeah.
medicines.
Okay. So they
So
believe that.
they in fact, I find it very strange. They in fact always told me to go towards alternate medicine.
Mm.
So yeah, although honestly, I was not very interested. I was
Okay.
never interested in it. But when I went and joined the college and I spent about a couple of years, I was inspired by a couple of teachers there. One of them
Okay.
was Dr. Vijay Vaishnav. I was inspired by them, and that's why I often tell that there are no bad students only bad teachers. So we need better teachers,
Yeah.
better icons who we can look at and feel inspired by.
Yeah.
And that's what I attempt to do. Let's see.
Yes, you are doing very well. Very well. Keep it up. But as an acclaimed author of 3 books, what inspired you to write these books? Like, was there a need in your research that you felt you wanted to share with the world? Is that where you wanted to
See,
write these
what
books?
happens, unfortunately, homeopathic literature, and one of the reasons why homeopathy is not very popular is the previous homeopaths, many of them, the literature is very complicated. It's not very easy. If you open a old homeopathic literature, you will not be able to read it very easily. You will not understand it so easily. And some previous homeopaths had a habit of not telling the real homeopathy to their students. They had a habit. That's how some of the homeopaths were. So I wanted to break that kind of a juncture, and I wanted to. The whole idea of me writing books was to make a simplified version of whatever is already there. I'm not inventing something, a
Yeah.
rocket science out of the world here. That's not what I'm doing, and I'm not even claiming to do that.
Yeah.
I just take the topic and I try to make it more friendly, easy
Okay.
for our students, so that I can inspire them that yes, you can do.
Yeah, that's amazing. That's great. I have a question here from Colin. He says,
Sure.
how do you feel about connection between Ayurveda and homeopathy, both being holistic and natural?
Yeah, it's Ayurveda and homeopathy both are alternate medicine, but both the philosophy of both is quite different. Although Ayurveda, it's a crude medicine. You're taking medicines in a very heavy form. Homeopathy, you actually dilute the dose, you potentize the dose, and you are actually taking the medicine in a very minor form. And there are no side effects to homeopathy. Although I very highly respect and admire Ayurveda as well, I believe that both have their own roles and both have their own places in
Okay.
medical science.
Okay, great. And I have another question from Pia. She says, can alopecia disappear in adults? If yes, with the help of which homeopathy and how long? Thanks.
Generally, it will take anywhere between 1 to 2 years, and homeopathy can help. Alopecia, and I can show you many cases of alopecia if we have the time. Alopecia is generally one thing that is often stress related. So, Pia, if you can look back into your life, you will realize the different stress factors causing it. So, you should meet a good homeopath. If you want to consult to me, you can consult me also. If you want to consult anyone else, you can consult anyone else also. But whichever homeopath you choose, stay with him for at least a year. He will also suggest you some changes. Do that and it will help you. All right.
Okay. Okay, great. And Sam is asking, if we do a consultation and do not live in India, are there medicines available globally?
Yes, medicines are available globally. There are pharmacies across the world, and we can help you to get those medicines also. So we are doing online consultation across the world now. So everything can be kind of worked out, no problem. Easy.
Okay, great. And Hia is asking, can homeopathy help cure acne in teenagers?
Yes, hormonal problems. So homeopathy can beautifully help. But along with that, I will also here suggest some lifestyle changes. If you do, it will help also.
For the teenager, yeah?
Yes,
Okay.
yes, absolutely.
Okay.
I often so Sanam, we have kind of, I'm trying to make like a holistic center in Mumbai where
Okay.
there is homeopathy, yoga, diet changes, kind of all these together. And when we
Yeah.
do all these three things together to a patient, beautiful changes can happen.
Yeah, I love that. That would be amazing.
We are trying to build that. So let's
Yeah,
see.
because I don't think there are too many like that,
There
right?
aren't many. And
Yeah.
but even if there are some, there can always be more.
Yeah,
Everyone
of
can
course, of course, of course. That's for sure. And Trupti is asking, is there a treatment for autoimmune diseases like rheumatoid, etc.? If so, what? Can it help with boosting immunity? Can it help with hair loss?
Yeah, homeopathy can help in autoimmune disease. In fact, it is known for treating autoimmune diseases like rheumatoid, etc. Definitely, it can help.
Okay, and so it can help with boosting immunity and with hair loss also.
Absolutely.
And internal injuries like shoulder impingement or hurt around the spine.
In fact, many athletes, many Olympics people who are actually into Olympics, or many sports people, use homeopathy for injuries because there are no side effects.
Yeah. Okay. And she's saying it takes, no diabetes, any options to heal faster and better. Don't know what she means.
Any options to heal faster and better?
Yeah.
Proper homeopathic medicine, certain diet changes, certain lifestyle changes, certain yoga exercises. We do all that together. When you connect to me, I can guide you.
Okay. And Komal is saying sons eat a heavy breakfast. In homeopathy, what would be the right diet regime? Like,
What would be the right?
do you
Again,
believe in? Sorry.
there is nothing called as right diet. First of all, it is again very individualistic. For someone, a morning heavy breakfast will work better.
Yeah.
For someone, a little lighter breakfast will work better. You have to understand that you cannot have a fixed rule. The only rule is there is no rule. It is very individualized and customized depending on you, your patterns, your health, and your situation.
Okay, great. And an anonymous attendee said, "I can't remember any dreams." So what does that mean? That sounds
It
like
doesn't matter. It just means that there is no strong subconscious suppressed emotions that you have. So there are about 75-80% people may not remember their dream. That is okay.
Okay. And then another anonymous person, would blood test have any role in homeopathy?
Yes, we often give the medicine and we keep checking on the your reports, how you're improving, all that. For that blood test we can do.
Okay. And what about muscle tears, says Meenu?
Yes. Sports
Yes.
injury homeopathy is beautiful.
Sports, yeah.
Everything you're going to ask me, I'm going to tell you that homeopathy will help. Now, how much percent homeopathy will help depends on the case, the extent of the disease, the patterns that you're going through, and how long you can properly follow up with us. So all these factors are important.
Okay. And does it help with autoimmune hemolytic anemia?
Yes.
Hemolytic. Okay. It helps.
Any kind of autoimmune disease and hormonal disease, homeopathy I will put above most other kind of treatments.
Okay. Sir, I daily try to learn and become like you, but daily, sir, after looking you, I feel myself at zero. So how to push myself?
Abu Bakr is one of my students from Pakistan. So he's watching this talk from Pakistan. He's also his family is my patients also. So yeah, Abu, don't give up. You are just at the initial phase of your life, and just work harder. Just take one every day as it comes, and consistency, and do it with passion. Your day will come gradually. All right.
Okay. And what Divya is asking, what food does homeopathy think as anti-inflammatory?
There is nothing what homeopathy thinks are anti-inflammatory, but at a general level, there are certain food items which are very anti-inflammatory, like turmeric, kurkuma. We call it as kurkuma long. Okay. So all these, there are many food items in naturopathy which are anti-inflammatory. I also try to study a little bit about all these kind of things which are also interesting. We have to be up to date with today's times.
Okay, great. And Divya says, please share your thoughts on acute frozen shoulder.
Yes, homeopathy can help very beautifully.
And also, I think Shobna is asking, how does homeopathy help with PCOD?
Absolutely. PCOD, we are doing a research on PCOD with homeopathy. I'm treating like 50 and hundreds of cases with homeopathy, and we are researching very good results. But lifestyle change along with it. You have to lose a little bit of weight. You have to change your diet. All these are important, Shobna. Okay.
Okay. And what does he mean by healthy diet? What is a healthy diet?
Healthy diet, again, is very, very customized and individual. The kind of diet I will suggest for Sanam will be different to something that is I will suggest for Utsav will be different to someone else. Because depending on their constitution and what are their problems, I'm going to suggest.
Okay. Okay, I think these for now. And I would like to digress a little bit and
Sure.
talk to you about what has been the biggest crisis you had to face in terms of your career, and how did you cope with that?
Um, I don't know how to say this, but I think my career has always, I've not looked at my life as a career. I, contrary to like how people look at life as career, I try to look at what I do as something that that is like a calling, that is more like something which is not work. That's why, on a Sunday I'm doing this like a 1 hour thing with you. I'm
Yeah,
not looking at it, oh Sunday, I want to relax, or I want to sleep, or I want to chill. I
yeah,
enjoy it. It's a calling, it's a vocation, it's something that makes me get up in the morning and do it.
hmm,
So personally, in a professional setup, there hasn't been such a kind of a crisis, because God has been kind, and prayers have been there. But it's not that I have not had crisis in my life. I have had different type of crises in my life. And I can just tell you that every crisis that I've been into has just made me more stronger, and has taught me something which has helped me grow. That's the way I try to look at it. Although when it happened, I was totally shattered and disappointment, and all that, just how everyone feels.
yeah,
But I try to introspect and try to see what I can learn from it, and how I can become more stronger at all levels.
yeah. That's the right way to go. But it's
Yeah.
so good that you can do that. It's always easier to say it than to do it. But
No, it's not very easy to do it. But if God has put you in this place, He
yeah,
will also find a way to get you out of it.
true. I believe the
But
same.
you have to do everything. God is not going to do anything.
Yeah,
You have to do it.
yeah.
That's the secret. Yeah.
Great. And so on your Insta account, you address yourself as a peaceful warrior. Can you
Peaceful.
shed some light on this,
It's
please?
actually, it's actually because of one of the movies that I saw about 12 years back, and it's called as The Peaceful Warrior. If you Google it, it's a kind of a book written by Dan Brown, and a very beautiful movie also based on it, called as Peaceful Warrior. And I don't know, but I feel very connected to that movie. And in almost all of my crisis moment, I have gone through, and I've seen that movie. Honestly, I see that movie at least twice a year.
Wow.
And yeah. And I know all the dialogues by heart. And it helps me, in every difficult situation. For example, there is a situation in that movie where it's a movie about an athlete who undergoes an accident and loses his feet, and then he is on bed, and how he fights back and struggles and works on himself, and actually does go beyond himself and wins and goes to the next level. It's a true story, by the way. It's by the author himself. It's a true story. You can Google about it. So in that movie, the peaceful warrior, that means, he's actually guided by one mentor. In the end, you come to know that the mentor that he feels is his mentor is actually not his mentor.
Mm.
It is actually he's talking to himself only.
Oh,
So
wow.
he the main thing of it is that, you have to find the love in what you do.
Mm.
That's the secret.
That's the
You do
biggest
not give
secret.
up what you love, but
Yeah,
you find the love in what you do. That's what it
yeah,
is.
yeah. Beautiful. I have another question from Barka. She says, I have shooting pain on my heel and side of heel. Sometimes there is shooting pain. Doctor said there is bone growth.
Yeah. So
Any
it's
suggestions?
most probably Barca has something called as calcaneal spur. It's called as calcaneal spur, Barca.
Okay.
So we can treat it with homeopathy very nicely. No problem. If you have an X-ray reports, you can send it to me, and I can have a look, and we can have a consultation and help you out.
Okay. So at the end, I can
We'll put up the email ID, and they can email us.
yeah. Okay. Great. And then somebody else is saying, Farzana, Dr. Gaurang, it's nice to listen to you.
So Farzana ji is my very close friend, who's also my first co-author, Dr. Ramesh Chogle.
Okay.
His mother, and very close to me, like very close family to me. They are based in Muscat now, Farzana and her husband.
Wow.
So yeah, very close to me, like almost as close as my parents. So I
Wow.
told them to join. So they are here to bless us. Yeah.
So sweet. So sweet. Kavita is saying, how about rheumatoid arthritis. I have been having it for the past 30 years.
See, when you have something very chronic, it is going to take time for it to kind of reduce. But our first target will be that we can kind of slow down the progress of the disease and then help you try to remove it from the root.
Okay. And somebody else says, I have dreams which is always incomplete. Whatever I'm doing in my dream, if I want to complete it, is always incomplete. What does that mean?
That is one of your inner patterns, Mr. Anonymous. Something you want to do is incomplete. It's an inner pattern. We have to go a little deeper at different areas of your life and understand what it means. I really cannot tell you offhand, and I hate discussing personal symptoms on the on a webinar, because these are very personal things, and
Yeah.
I always like to do this one to one.
One-on-one. Yeah, I think that's a good idea. I just had another question. What
Go
is
ahead.
what is the most remarkable moment you have had when it comes to your practice?
Most remarkable moment. Sanam, I strongly believe in this. I'm a work in progress. I'm not complete. I'm a work in progress. So I believe that the most remarkable thing that I will feel or I will have in practice is yet to come. Is yet to come.
Okay, wow.
But yeah,
but you've done so much. You still don't feel
I've done my little, whatever I could. But I believe that I have blessings of so many people who I was able to help a little bit. And I know that one of the reason I am alive is because of blessings of so many people. So I just try to give back whatever positive vibes and blessings I've got from so many people. I can feel that blessings,
Yeah,
and I know
that's so
how I'm
nice.
saved in my life. So I just have prayers and gratitude,
Yeah,
total gratitude to them. Yeah.
that is really what it comes down to. Prakash is saying thank you, peaceful like a saint and a brave warrior for your talks.
Thank you.
And so I wanted to ask you if you wanted to call upon some people to share their experiences with homeopathy.
I thought that we could invite a couple of my patients to just share their ideas. They were very keen. One of them were very keen as well. So I don't know, Utsav, can you find a way to share, one of the patients and a very close friend, like a family friend for me. She
Okay.
helped me with my first book also, Sabina ji. She's based in UAE only.
Oh,
One of my
okay.
patients, family is my patient. And another is again one of my friend and student, and she is based in Delhi, and we help many COVID cases in the last wave. Her family, her relatives, we help with homeopathy. So maybe they can share 1 minute each, and
Okay.
just a lot of patients will actually, a lot of people who are watching will come to know the real depth of homeopathy. Maybe
Yeah, it'll
Utsav
be
can
nice
help
to
us
hear.
to navigate through and invite. Hopefully,
Yes.
Yes, sir. I will allow them to talk. Just a
yeah.
second.
So in the meantime, should I
Sabina,
give out your email address?
Sabina ji, you
let them.
can speak now. You can unmute yourself and switch on your video.
Okay, we can see Sabina ji now. Yes.
A very big hello, Dr. Gaurang. A very big hello to everyone out here. Thank you for joining in. And I'm so excited to be here with y'all and just couldn't wait for this moment. But at the same time, at the back of my mind, I must admit that there were a great flutter of butterflies in my tummy. There were butterflies of fear, butterflies of anticipation, butterflies of nervousness. Finally, I implored them. I said, my luminous friends, please leave my tummy and flood my heart. Illumine it, inspire it so that I can say my part. So good evening again. My name is Sabina Mirchandani, and I'm here to speak about my experiences with homeopathy. So I'll launch into this by telling you two stories. The first story I would call Pushpa Ma and homeopathy. So Pushpa Ma was my beloved mother-in-law, and she had cancer revisiting her at 90. She had a relapse of cancer after 19 years. And this time it was very, very aggressive. It was very, very advanced. And the FNAC from the cytopathologist confirmed these grim ramifications, and gave us the final verdict, which left us all very shocked. And this final verdict was that she needed a radical mastectomy of the right breast. So we were all devastated, and we really didn't know what we could do, because there was fire on one side and there was fury on the other. Now, what do you choose? We were also told by modern medicine that we had to go straight. We could not opt out of this. We had to focus on the mastectomy simply because there was no other option. And that the volcano of cancer, which was dormant now, would express itself very violently. It would become active, and then she would have to face a lot of suppurative abscesses, stenchy abscesses, and there would be all these additional problems that could crop up for her. So at this point, there were two clubs in my family. In one club, there was my sister-in-law, my brother-in-law, and my husband. And in this other club, there was me. And there was my earth angel. I choose to call her my earth angel. And that is Sudha Didi. Sudha Didi, this one is for you. So it was because of her strength and her presence with me that we looked at a window of opportunity. That window of opportunity looked out at the oasis of homeopathy. So we were both able to look together at homeopathy and as it being an open option for us. So my supercharged sister reached out to Dr. Gaurang, and she asked him if we could just let my mother-in-law be, because she knew that to take her towards surgery was to push her into the fire. And Dr. Gaurang was so reassuring. He was really so reassuring. I'm so grateful to you, Dr. Gaurang, because with your reassurance, the picture entirely changed. And you just said that she does not need any surgery, and that homeopathy would help to block any of those fallouts of abscess and stenchy and suppuration and blah, 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 blah. So what happened to my mother-in-law? She lived for 11 months after this event. But how was the quality of her life? The quality of her life, the life that homeopathy gave her, I can truly never express my gratitude more for this gift from homeopathy and from Dr. Gaurang, because she lived so blissfully and she lived so easily, and she did all the things that she loved doing, going to the garden, spending time with her family, eating all the things that she loved, excepting we were counseled about dairy and we were counseled about sweets. So we opted out of all that, but she had a really, really blissful life.
Beautiful.
Talk of eat, love, and pray. This was truly her life for 11 months. And yes, Sanam, a very big good evening to you also.
Thank you.
So, so with this, she went, like, she did not have any issues, and she did not have any probes, any catheters, any tubes, anything. She just went normally, feet, standing on her feet. And she was alive, and the quality of her life was so beautiful. It was so normal. So homeopathy gave her quality, not quantity. But after all, it's quality that's more important, is it not?
Yes, correct.
So when she finally went, she went very blissfully. And that is how homeopathy did all that and more for her. Now I'll go to my next story. My next story is about my father-in-law, that is Daddy and homeopathy, I used to call that. Now his story is also equally interesting. And now in his case, he had an implant of the pacemaker at 88 years of age in 2017. And after that successful implant, he was on the normal medications. But those medications played havoc. Normal medications, normal modern medicine medications. But they truly played a lot of havoc with him, because he was not able to somehow, let's say, adopt them. His body was not able to adopt them. And so he landed up in quite a bad state. He lost weight consistently. He lost his enthusiasm. He lost his zest. He lost his patience. He was so depressed. And physically, he was getting more and more emaciated. And at this point, again, my earth angel, Sudha Didi, I hope you're watching. This one is for you. She acted out of her own convictions. And she contacted Dr. Gaurang again. And as usual, he was so kind and he was so supportive. And he said that we needn't stick to all the modern medication that was prescribed, and that homeopathy would take care of his heart rhythms, and homeopathy would take care of his weakness. So that is how it went. The story went. Modern medicines were gradually tapered off. Well, in his case, it's not only quality, it's also quantity, because he's living very happily as a man can live, in full dignity, walking around, talking around, enjoying life, laughing around. What more could a man want from this at 93? I mean, it's really, homeopathy has really given us eternity. So these are the two stories I'm done with. And to finally end this, I'm going to again talk in poetry. And I'm going to invite everyone to come and fall in love with homeopathy. Come, please, my friends, fall in love with homeopathy. Make a date, take a chance. You may not be impressed at first glance. Give it your patience, give it your time, and it may turn out to be an everlasting romance. So thank you, my friends. It's been so nice talking to you. I'm so elated that I was able to do my bit.
Sabina ji is basically a writer, huh? And she's a totally literature person. And she even helped me in editing my first book, Decoding Mental Rubrics. So I'm so grateful.
Very lovely, very lovely. Thank you so much, Sabina. That was
Thank
beautiful.
you so much, Sanam.
And the other thing is that she's actually not a homeopath, but she knows the entire homeopathy. So there are many people across the world who are not homeopaths, but they know homeopathy probably as much as homeopaths, and one of them is Sabina ji.
No, I think Dr. Gaurang is causing a very gross exaggeration. I don't really. I think it's all because of him. Whatever I have learned, I've learned on his 6-month online course, and I'm fascinated. I'm enjoying this, and I would just like to appeal to everybody out there that please inform yourself about homeopathy. Please, you must make an informed choice, because it stands on par with allopathy. And as Dr. Gaurang said, there's space for every pathy in the sun, under the sun. There is more than enough space. It's the yin and the yang. I mean, it's like two sides of the same coin.
Yes, beautiful.
So please, my friends, I pitch for homeopathy. I seriously pitch for homeopathy. Please love homeopathy. Please know homeopathy. And, in this environment of COVID, where COVID is threatening our life and where we are all, sort of panicking for the next vaccine, and there's another mutation, I would just say that why not go under the shade of homeopathy? I mean, I would not worry about being not vaccinated. It's like we wear a medal. Are you vaccinated? But I would say just go for homeopathy too. Try it too. Why burden?
Thank you so much. Thank you so much.
Thank you. Thank
A
you.
lot
It's been a
of
pleasure.
great, beautiful things said about it. Yes. A lot of people saying thank you for your beautiful words today. And I have one more question. Is it okay, Dr. Gaurang?
Yeah, sure, go ahead.
Wait, where did it go? Okay, I feel nervous when homeopathy is deemed to be a replacement for important medicines for chronic conditions. I trust your experiences, but want to be cautious. Please advise your thoughts.
It's a good question. Number one, we do not replace anyone. Number two, in most cases, for the first 6 months to 1 year, we keep allopathy along with homeopathy. And once we start seeing the results, gradually, very slowly, we taper down. So it is done in a very, very careful and a very, very kind of methodical manner. So don't worry about it.
Okay, beautiful. And Sabina,
I'm more anxious about the patient than you. Don't worry.
And Sabina ji, you got a compliment, your spirit of collaboration, and you have awakened an interest in even a sworn allopathic person like me. So that's great. And I would just like to ask Dr. Gaurang, if you have any final message before we end, if there's anything you have to say.
Just before we end, there is my friend, colleague, and a doctor from Delhi who specially joined. She wants to share about her experience with COVID and how we treated homeopathy in COVID hospitals in India. She wants to just share for a minute. She's especially waiting for an hour. So, I thought so Utsav, can you please connect Dr. Radhika, please.
Yes, sir. Dr. Radhika, you can talk now. You can unmute yourself.
Good evening, Dr. Gaurang. Thank you so much for inviting me, first of all.
Hello,
It's
Dr.
a great pleasure to share a screen with you. And good evening, Sanam. First of
evening.
all, I would like to thank Dr. Gaurang as well, as with the help of homeopathy. I mean, I can say many of my relatives, many of my friends got cured from COVID, and that too with the serious cases of COVID who were there in ICU as well. And it was a great experience with homeopathy when someone don't believe and when they get the results with homeopathy. So it's like it's a magic for them. So one of my friend, he referred a case of COVID. His brother was admitted in the hospital and in ICU, and his CT score was 25 out of 25, and in a very critical stage. And that time, when I mean referred the case, and I talked to Dr. Gaurang, with his support, with his motivation, and with the help of homeopathy, we were able to cure him. And now he is perfectly fine. Within 1 week of treatment, he is doing much better. And in relatives as well, many of my relatives got cured with homeopathy, and old age people. One of my granny, she got recovered with homeopathy in 1 week itself, and they are very happy with the results. I mean, homeopathy plays an important role in every stage of your diseases, or you can say in every phase of life as well. And basically it's a healing, not a suppression, nothing else. Basically it's a healing from within. So we are getting cured with that. And now I mean, many of them, they are asking for reference of Dr. Gaurang as well, say, as many of the cases have got cured from COVID, so they are asking as well. So gradually we are curing the cases, and with many effective results.
That's
Thank you so
great.
much, Dr. Radhika, for sharing. Thank you.
Thank you so
Yeah,
much.
thank you for sharing. I have on the chat put Dr. Gaurang's, I put your email address and your Insta and your website. So if
They
you
can
would,
just email me. They can just email me for the consultation. The best way is to email me.
okay,
Whatever your problems are, and we will have if it's necessary, we'll have an urgent consultation. And
okay.
I'm very happy to help as many people as we can. All right.
Okay, great. So it is so important to be contributing to yourself and to society. Live with a purpose and have a zest for life. If we can all live our lives by saying, today is a new day, and how can I make a difference? Our approach to life would shift. It's so important to be vibrating at this level and to keep pursuing your passion, because that is what can help us make a difference in the world. I realized that homeopathy is a medical system based on the belief that the body can cure itself. I guess it is very important to have that faith and conviction that homeopathy works. This is the most important thing, according to me. Dear viewers, I believe faith can move mountains. Yad bhavam tat bhavati. This is a Sanskrit proverb which means, as you think and feel, so it shall be. Baba says even 1% of doubt is not 100% faith. So let's remember this and keep our faith going. So dear viewers, I hope you enjoyed the beautiful conversation we had today. And as I've written, if you have any other questions, you can email Dr. Gaurang, and I'm sure he would be willing to help you. Yes, and thank you, Dr. Gaurang, for spending
you.
so much time with us today. And I'm sure it has cleared everybody's doubts and confusions. And I hope I could answer as many questions as possible. I mean, ask all the questions that were asked for you. So thank you so much.
Thank you so much, Sanam. I want to congratulate on this very interesting initiative that you have done. And I hope that you finish your 100 episodes of this very soon. And
I was thinking of taking a break after this one for summer.
yeah, but whenever after the break you start.
Yes,
But
yes.
I want to tell you that don't stop, keep continuing it. Even this will make a very vital difference to many people's life. So continue your passions, and it has been an absolute pleasure and honor to be a part of this. And
Thank you.
I'm so happy. Thank you. Namaste.
Namaste. Thank you. Thank you so much.
See you again. Bye.
See you. Bye.
Bye.